Hello, everybody. It's March 30th, 2021. I'm Gary Pace, Public Health Officer for Lake County, and we're here to give the COVID response update for Lake County at this point. For a quick overview, the cases are rising nationally. There's a lot of concern now about increase in cases around the state and around the country. In Lake County, we're not seeing a severe rise, but it's not improving anymore, and we've sort of plateaued a bit. We are continuing to roll out vaccines around the county, and overall, there's been a little bit of a slowdown in the last week because of some of the changes in the state appointment platforms and things like that. But overall, we're continuing to get vaccine out in the community, and we're still in the red tier, and it looks like we'll probably be there for at least a couple more weeks. So Sarah can give us some of the specifics, and then I'll come back and have a little discussion about some of these things.
Thank you, Dr. Pace. So I'm going to give a quick update of what we're seeing at the state level and in Lake County. On the left, we're looking at a graph of total tests performed in California. Testing continues to decline, but it's slowing. So compared to last week, there's not much of a difference in terms of the number of tests conducted statewide. And on the right, we're looking at the testing positivity. So the testing positivity for the last 7 days was 1.6%, which is the lowest that we've had since the beginning of the pandemic. And this has been a 0.2% decrease from the 7 days prior. So as the graph shows, this decreased fairly rapidly. And now that we're reaching close to 1%, the rate of decline is slowing. The number of cases in California, so we're looking at a 7-day average, a 7-day lag, does appear to still be declining, but it's the rate of decline, we're starting to plateau, as Dr. Pace mentioned. So again, good indicator. 4.7 cases per 100,000 is our 7-day average, 7-day lag, which is significantly lower than we've had throughout most of the pandemic. But we're watching this closely to see if we're just plateauing or if we're going to see an increase. As cases have declined, the number of new cases have declined, as we've discussed previously, so are the number of new deaths due to COVID. And that's what this graph on the right reflects, declining deaths due to COVID because we have fewer infections. As Dr. Pace mentioned, Lake County remains in the red tier, which indicates substantial COVID transmission. So for the period of March 14th through the 20th, the daily case rate in Lake County was about 8.6 per 100,000 residents, and the testing positivity was 4.3%, which was similar the testing positivity that Lake County had last week. This map here shows the status in California's 58 counties from last week. This map will be updated later today, but showing it to show that most counties are in the substantial or red tier. Here is the epi curve for Lake County, and this is showing our surge at the end of December and into early January, and then the dramatic decrease in the number of new cases as we saw statewide. And like Dr. Pace mentioned here, we're plateauing around 37 to 42 cases over the last couple of weeks. So this week here, the week of March 14th through the 20th, is what makes up our tier metrics announced by the state today, solidly in the red tier due to the daily case rate. And what I'm showing here, the week of March 21st, so the week that just ended, to date, we've identified about 14 cases. So I expect that we'll have another week of red tier metrics for the week of March 14th as new cases are identified as lab reports come in from the previous week. Wanted to give a quick update on progress statewide in terms of the vaccine. So as of yesterday, 36% of Californians are at least partially vaccinated. So specifically, that's over 5 million Californians 16 years of age or older are partially vaccinated, and that's 17% of the population, and 6.3 million people are fully vaccinated, and that's 19% of the state's population 16 years of age or older. This graph on the right shows vaccinations by number of people vaccinated by what we call the Healthy Places Index quartiles, which identify communities where there's more healthy community conditions and where there's communities where there's least or less healthy community conditions. And so the state is paying close attention to vaccines in all of these quartiles, but particularly in the communities where there's least healthy conditions and higher rates of COVID infections in many communities. And you can see here that about 19 to 20% of people in the Healthy Places Index quartile 1 have been at least partially vaccinated, where it's significantly higher in communities where there are more healthy conditions. So that's why the state is set the goal of administering 4 million doses in the Healthy Places Index quartile 1 before we lessen or reduce the daily case rate thresholds to move us forward. So in Lake County, there's been good progress over the last 7 to 10 days. 1 in 3 Lake County residents 16 years of age or older are now partially or fully vaccinated. So this is about 6,500 people who are partially vaccinated and over 10,000 people who are fully vaccinated. So 1 in 5 people in Lake County are fully vaccinated now. As we've noted before, these data are from the California Immunization Registry, and there is a limitation to it. It does not include vaccines administered by tribal health or the Veterans Administration, the VA. So we believe that actually closer to at least maybe 36% instead of 33% of Lake County residents are vaccinated when we include what we know from those other data systems. And wanted to give you a quick update on progress by age group. So nearly 2 in 3 people over the age of 75 are now at least partially vaccinated, and nearly 3 in 5 people 65 to 74 years of age are at least partially vaccinated. And as more vaccine has become available and more people are able to access it, particularly we're seeing that people 45 to 64 in the last week saw the most dramatic increase in uptake of getting their vaccine shots. So this is great progress. And as the state opens it up on April 1st and April 15th, I expect we'll continue to see good increases among the younger age groups. And then we're looking by race ethnicity to understand who's getting the vaccine in the county, just like we do with age groups. So we're seeing about 21% of white non-Hispanic residents have been at least partially vaccinated, about 19% of Latinos, 15% of Native Americans, but we know this is an underestimate because it does not include the tribal health data. And then multiracial, many people who have gotten their vaccine dose have identified as multiracial, more so than the official US Census estimates of that group. So that's why you see this greater than 100% on the graph here. So the race ethnicity data at the local level, when there are smaller populations, the estimates are not as reliable or stable. So these should be interpreted for all these racial ethnic groups as estimates with some degree of error. And then lastly, I showed the graph at the state level. There are, for who we're vaccinating in the Healthy Places Index quartiles. So in Lake County, about 5,650 people 50 people are at least partially vaccinated in these zip codes, which are in the Healthy Places Index quartile 1. And about 10,800 people in these zip codes in Healthy Places Index quartile 2. So in HPI 1, about 44% of the Lake County population lives there, but only about 33% of people have been partially vaccinated. So there is a focus on providing vaccines in those communities, and there has been a higher percent increase in the last 8 days or so, focusing vaccines in those communities compared to HPI2 communities. That's the update for today, and just wanted to close that, continue to make progress, and more than 1 in 3 Lake County residents are partially or fully vaccinated. Thank you.
Thank you, Sarah. That's great. So to emphasize, we are seeing consistently higher case rates than we would like to see. It's not dropping significantly. It's not rising at this point, but we're concerned that we're not seeing it improve. And again, around the country, there's a lot of concern seeing these cases rising again. We're starting to see a slight surge. I think there's 2 things that are happening here. One thing is that people now, we're loosening some of the restrictions, and so people are outside and more active. There's indoor dining at the restaurants. There's a lot more activity, and I think people are relaxing some in terms of not using masks quite as diligently as they had been before, and also not social distancing in the same way. And so we really want to emphasize the importance of people continuing to do all these protective activities, because that's very likely one of the causes that's having us see this continued elevation of case rates. The second is the variants are around. We've now identified a second variant in Lake County. The first one is the one that's called the West Coast variant. The second one is the one that's called the United Kingdom variant, the B117, that's getting a lot of media play because of what's happening over in Europe. And we have seen now a couple of the cases have been identified as having the B117 variant now. So that's probably leading to more transmission, because we know that this variant is not more deadly, but it does transmit more easily. It's more contagious than the other ones, and so more likely to spread. So it's just, the vaccine does seem to work against both of these variants. And so we're encouraging people to get vaccinated, but it's also important to, if you're not vaccinated, or even if you are vaccinated, but for everybody to continue using the mask and the social distancing. So let's talk about the vaccine, because this rise in cases, really the answer is, again, masking, social distancing, but the vaccine is the thing that's going to really slow this down and get us back to a more normal lifestyle. So the numbers in the inventory are pretty good. We're getting a consistent amount of vaccine from the state, and we're continuing to push it out through the sites. So the state is loosening up some of the eligibility requirements. So starting this Thursday, so day after tomorrow, people 50 years and older, anybody who's 50 or above is going to be eligible for the vaccine. So if you've not been eligible, but for various, if you hadn't met the eligibility criteria before, and now you're 50 and above, you are going to be eligible. So I encourage those folks to go for it. Try to get an appointment as soon as you can and get in this week or next week and get your vaccine. We're not sure how much demand there's going to be, and we do have the setup for it. So we'll go ahead and get it out as fast as we can. Starting April 15th, people 16 years of age and older will be eligible. So basically everybody 16 and above will be eligible starting April 15th. Again, we don't really know what the demand is going to look like. And so let's talk a little bit about how to go about and get an appointment. So right now, the main places to get the vaccine are the health department drive-through sites, which is 1 day a week in Lakeport, 3 days a week in Clear Lake. It's also at Sutter or at Adventist. They're both providing vaccine now to people. They're providing it to their patients, but if you're a community member and you're not already established with one of those with either Adventist or Sutter, or you have a different provider someplace else, they will go ahead and vaccinate you as well. So for Adventist, you can call the phone number for it's 995-4500. So 995-4500. You call Adventist and they can set you up for an appointment if you're eligible. For Sutter, the number is 262-5088. And again, both of those places are seeing community members. If you're a patient already, or if you're a patient elsewhere, it's fine. They'll go ahead and provide you the vaccine. These are no cost. You do not have to have insurance. And, this is a great way to get it. The health department sites are also vaccinating a lot of people. And the way to get on that is through myturn.ca.gov. So it's myturn.ca.gov. That's the website. And you go ahead and can make an appointment on there. If you try to go in and the appointments are all filled, just check in again later, because like today, we're going to open up the appointments for next week. And so if you check in later today or tomorrow for appointments next week, they should be available by then. This is true for first doses and second doses. That's how you make it, is through the MyTurn website. If you have problems getting into either of those ways of getting it, give us a call at the Mohawk line or at the 211 number, and we should be able to help you out. Safeway and North Lake Pharmacy are also providing some vaccines, so you can try to go through those sites. Tribal Health is also giving a lot of vaccines, and they're opening up to the community sometime next week, I believe. So the other question about the appointments comes up is how we're dealing with folks that are out of the county. We are continuing to exclude people that do not live in Lake County or do not at least have a second home here. So we've been able to continue to keep not allowing those folks into the county to get the vaccine. So so far that's not been a problem. The state may be changing the rules on that, but we haven't had problems with that at this point. So we are doing a lot of staffing changes. We got some support from the state with a big group of people coming in to help. And there's been a transition now from the folks that have been helping us for these several months. So we've had a huge amount of support from the local community with the volunteers and with the county workers that have been moved around to help us at the site, and also with some of the temp agencies and other folks. This is again another example of Lake County just really stepping up to the plate and taking care of each other. And we've been extremely grateful of a lot of success of getting the vaccine out with all this help, because there's absolutely no way we could have done it with just with the health department folks. And now the state has given us a staffing, so we're shifting over to using them. And it should allow us to continue on for the next couple months, which is going to be really important to try to get the demand taken care of when all this vaccine's coming in. Probably after a month or two of continuing to do it like this, we're just going to be shifting more towards the clinics providing vaccine to the community, just like when you get your flu vaccine and things like that. But for the next couple months, we'll probably be having these big mass vaccination sites. So I just wanted to talk a little bit about the vaccine hesitancy and people being reluctant to get vaccinated. Really want to encourage people that we're not seeing a lot of problems now with the vaccine. And it really seems like, especially with these variants moving around and the increased case rate, the more people can get vaccinated, the better it's going to be. There seems to be very little downside at this point to getting vaccinated. And we're just not seeing problems with this vaccine, and it seems to be quite successful. So really encourage people to get the vaccine as soon as they can and protect yourself. It doesn't seem like the people that are vaccinated are getting infected very often at all. It seems to be very good protection. And we do know that it definitely protects against severe disease and death. So please go out and get it, and we'll be a lot more likely to have a better summer this year. So, in conclusion, we are seeing this kind of concerning pattern with the increase in cases now. I think it's really important for people to wear their masks and to get vaccinated. That's really the bottom line at this point. We are in the red tier. It looks like we'll be there for at least a couple more weeks, but there's definitely more activity out and about. The kids are back in school more now, and it's there's just a lot more opportunity for the virus to spread. If you are vaccinated, you still should wear your mask, but the risk of getting infected and spreading it seems to be quite low. So the people that are getting vaccinated are really freer to move around more and able to do more with less concern. So, please be careful out there and sign up to get the vaccine. If you can't figure out how to sign up, because it has been a little bit bumpy trying to get people appointments, give us a call and we'll try to get you in. So thank you.